Our industry is about the care, health, and healing of the communities we serve. If you can bring your whole self, have a sense of belonging to work every day, you can differentially make what we do better and the experience of patients better.
I'm Chris Malone, and we're glad you could join us for today's discussion. We'll be talking about listening to caregivers and elevating their voices. Before we begin, I'd like to once again welcome our friend, colleague, and program partner, Michael Giuliano. Michael is the president of Planetree, which is a global not-for-profit organization dedicated to humanizing healthcare for everyone through excellence in person-centered care. Michael, what can you tell us about today's guest?
Welcome, everyone, to our April episode of Humanizing Healthcare. It is with great pleasure and honor that I welcome Dr. Shannon Phillips. Shannon is a pediatrician and the chief health officer at Joyous. Prior to joining Joyous, which we will hear more about, she was a health system executive, most recently serving as president of Intermountain Medical Group, and in prior CMO, CXO, and CQO roles at Intermountain Health and the Cleveland Clinic. She is also serving on the board of directors at the National Quality Forum. And what I most like about Shannon is what she describes as her hope for healthcare and caring that is made safe, effective, equitable, and human-centered experiences for all. I'm very much looking forward to speaking with Shannon and hearing Chris's questions. And thank you again for everyone for tuning in. Back to you, Chris.
Thanks, Michael. Well, Shannon, it's so great to see you again. Can you share a story about how you chose your career in healthcare? How did that all come about?
I might be a little typical in that I kind of was a math science person, but what really made the difference was I had a teacher who cared, who said, "Wow, you like this, you seem good at it. Why don't you dig in?" And I was fortunate. I grew up in DC. I lived like a mile from the National Institutes of Health, and so he helped me get a high school internship in a lab at the National Institutes of Health. And boy, that was a big deal. You walk onto this amazing campus and you're like, smart people are here and they're curing the world's diseases. And I was very privileged to work in a virology lab and do gels and electrophoresis when it was new and cool. I don't want to date myself, but it was kind of new. And what I learned was that while I am fascinated by the science that creates cures, what I lacked in all of that was my connection to people. And these are wonderful people and they connect with each other. But I learned pretty quickly that if I wasn't going to be close to touching, engaged with people and their stories, that it probably wasn't going to work for me. So a quick hop to being a very traditional kind of pre-med person. There wasn't a lot of medicine in my family. One actually pediatrician who I would see now and again. So I made the decision, I went. The thing that became my obsession for my career in healthcare was watching kind of recurring failures of our system to serve people, and how do we eliminate the recurrent issues that some of which had social determinants, some of which were our really complex ways we deliver care. And so eliminating the unnecessary steps and making our care compassionate and reliable has been my obsession. So there you go.
Terrific. So you went from research into practice into quality improvement.
Yes. And every day I get up, it's bad. My poor kids, right there. I'm all about how do you make something better, right? So I should sometimes leave it at work, but it doesn't always happen.
So as Michael mentioned, you spent time at Cleveland Clinic and Intermountain Health. I was wondering if you could share a little bit about your experiences there and how they have kind of influenced your approach to listening to providers and staff.
Yeah, so fortunate to grow up as a clinical leader. And then, as I said, my obsession and improvement, the privilege to be the Cleveland Clinic's first patient safety officer and lead quality there for a number of years, was just beautiful growth and exposure to things. And the mission of patients first at the Cleveland Clinic was very motivating and inspiring to me. The one of the most, I think, a night's nexus of connecting provider and really caregiver experience and patients was in the role I had the privilege to work on our early disclosure and resolution process there. So to say that we're a learning organization, that we want to uncover any opportunity to be better. And in doing so, how do we, of course, which organizations do, focus on the patient and family and the connection to them and being present for them in distress. The piece that was not as well filled out and is now, I would say, industry leading was how do we care for people, the distress, moral injury, the just pain and discomfort for our caregivers, whether it's a doctor, an APP, a nurse, a pharmacist, where we are finding such terrible remorse, and how do we work as a system to take what we've learned and make us better? Because everybody who comes to healthcare to work comes in every day to help people be healthy, and the distress in that is one of the many, which I'm sure we'll touch on, but one of the many things that are causing distress across the industry right now. And then at Intermountain, I would say I got smarter and a little crisper, and it was caring and learning, and that in order to be a learning organization and highly reliable, the first most important thing is to care for those who serve our patients, and then making sure we're providing an environment that feels for a patient and family like we care about them. And I like the term love for that, because we're humans. And when you feel someone cares about you, I think that element is present, not in the way I love my daughters, for example, but
Right.
that human connection is critical to serving all.
Yeah, well, I mean, intuitively, I think we all know the caregivers cannot provide care unless they have what they need, kind of physically and emotionally. But you also touched on something else that I'd like to probe on a little further. You mentioned at Cleveland Clinic, the culture is the patient comes first. Mayo Clinic, say the needs of the patient come first. How do we think you find the right balance between those things? And is it the case that you can do those both well?
You absolutely can. At Intermountain, the mission is helping people live the healthiest lives possible, right? And it is focused, let's be honest, our industry is about the care, health, and healing of the communities we serve. And so I think making sure that's front and center is really important. And then if we ask ourselves, okay, well, how do we do that? And what gets us to being the best at that? It is the care of those who serve, right? And so I think more and more as we've had workforce struggles, in my role at Joyous, I'm talking to leaders in health systems. If you say, what's the thing keeping you up at night, or that you most are focused on, it's retention and well-being and making sure that people find meaning and purpose in their work, so that this is the best place to be. And I think if you can bring your whole self, have a sense of belonging to work every day, you can differentially make what we do better and the experience of patients better. And I think for a while, maybe we got distracted by other things, maybe for a long time in some cases. And so I think that connection is super clear. But you're right. I think there were many, when I was president of the medical group, there were people who said, yeah, okay, the patient, and what about me? And that's real, right? And to not attend to that doesn't attend to patients.
Yeah. And I think that's what, at the bottom line, it's about humans caring for humans,
right?
And that has to go both ways. And that what we're learning from our work is that the interaction with patients is just as valuable to the provider, emotionally and professionally, as it is to the patient. And so we just got to make sure we don't lose sight of that. So what inspired you to join Joyous as the Chief Health Officer? And what are some of the things that you're working on there?
Yeah, so what a privilege. This company, I sort of ran into one of the CEOs and learned, I guess, what a great name, right? So I was curious, and they said, we think healthcare could use Joyous. And I said, okay, tell me more. And long and short, this beautiful tech company is really, its core business and mission is to connect leaders and the workforce to make work better for human beings and to make the companies as effective and efficient and humming with a wonderful experience for their customer as is possible. And so with the premise that connecting the workforce with the leadership to solve some of the most important problems or needs or issues is a win-win for everybody. And in fact, we might do less of the kind of pizza party and more of the make work better. And so this tool really spoke to me, and they have had a lot of practice, if you will, and customers in not healthcare industries. They have a few, which I really enjoy. And so my job has really been to bring this tool to my colleagues in healthcare and say, if we want to learn about how to make the work better, imagine having a human conversation to learn what the most important things are to do to make it better. And so here I am, and I would not have said, given everything else I've done in life, that I would have been at a tech company, and it has been just as rewarding and just in a very different way than the work I've done before.
So for the benefit of listeners, could you describe a little bit about how Joyous connects leaders to employees? How is it different than email or text messages or meetings or Zoom calls or other things that we are trying to do, right?
Yes.
It must be doing something different.
Right. So thank you for not using the term survey, although that people would sometimes confuse it. So it's really a bi-directional employee feedback or conversation platform that allows an organization to do targeted work on something that matters and improve operations. So think quality, think safety, think risk reduction, think consumer experience, really anything that is a priority of an organization. And it essentially supports a conversation that you have. So you select a topic that matters. Say you want to move the patient experience, or you want to work on provider experience in an organization. The Joyous team helps you create a campaign, which is a focused set 2-3 questions that you'll ask to an audience, and that audience can kind of be people who do the work and maybe people who receive the work, and ask them what ideas they have to improve that. So it's something you're trying to solve or improve. What it isn't is a survey. What it isn't is sentiment, right? The presumption would be that it's something important to work on. It supports conversations. So it asks a question. You can get text or email or Slack or whatever you use. And that caregiver, that team member responds, and someone in the organization, who we call a facilitator, responds back and expresses gratitude, says, hey, thank you for that, and asks a curious question about more specifics. And then the beauty of AI leans in. It can help with responding to what the team member said. It can help, it then themes and pulls actionable ideas and phrases out of those conversations, so that at the end of a campaign, a leader in a specific area has the voice of those doing the work or closest to the work about prioritized actions they can take to improve that. And so if I think about talking to providers, right, our typical is you get a survey, for example, you read a lot of comments around a diverse set of topics. You might be like, how can we make work better? And we manually go through and theme and and we don't get that chance to ask the second question. So what did you mean when you said that? And so what we do then is we spend time going around talking to people in, to your point, meetings, Zooms, focus groups, buying people breakfast and saying, come talk to me. And it's the first, maybe not respect of people's time and saying, you have to come see me because I'm here and tell me what you meant by this. And that only gets who comes, has a little bias to it, right? There's all kinds of missed opportunities in that. Whereas Joyous creates a plurality of experience. So it says, what did you personally experience in this topic area? What action do you see from your vantage point could make a difference? And then it sums those with the power of AI into the most important responses that could make a difference. And so it really shortens the window of getting speed to doing something at scale, because you can talk to dozens, hundreds, thousands of people if you want at a time, so that you can get to the most important work, which is making it better. So I fell in love when I went through all the things I wrestled with in both quality, safety, experience, and in operations. I could see this pointed at anything. So I'm a fan, and we're really excited to be jumping into healthcare.
Well, thanks. That sounds really, really interesting. Can you share an example or story or so of how healthcare organizations are using this and what they're finding?
Yeah, so the couple fully closed and done campaigns have that come to mind. One, for example, was in nurse retention. And in that circumstance, right, there's not an organization in healthcare, frankly, globally, that doesn't think about workforce that way. And what can we do? So this health system simply asked the nurses, salary and wages aside, because that is, there's a lot of impacts on that. But what would make this the best place for you to work? How would you be happiest working here? And rather than a survey, again, focus groups, they got asked that question, what ideas do you have? Had the chance to have a conversation with someone, and then identified a few things that work. And one of the top of the list things in this organization was actually, I want to use my skills that I have. And in the role that I have, there are things I'm certified to do that I don't get to do. So could we figure out how I can? And so they developed these wonderful mentoring programs, the opportunity for people to rotate to places to use those skills. And it has been not the only thing, but a very major piece of their retention program. A second that comes to mind is in doctor time and valuing, and simply a campaign that said, we value you and we want to value your time. What ideas do you have that will allow us to better value your time? And lots of great ideas to come out of that campaign. But interestingly, the top of the list was, could you make the computers work better? I sit and wait for the computers. And I'm sure no health system has that problem. So you can hear, wow, fix the computers. The beauty of a conversation is then you hear, what specifically about the computers? Because I can't read your mind, and there are a few things that could go wrong. And the number one issue was actually when the system would boot down or reboot every day. It was happening at a critical time where people were trying to round and do other things. And they heard it across geographies in this distributed workforce, and very simply could move that into the middle of the night and take it out of operation. And then I shared with you really briefly before we got on that we're in the middle of a campaign right now to bring efficiency to team meetings, and the joy of the team. It's not done yet, but to watch the feed and see the joy expressed in being asked to have a voice, and the gratitude expressed by the facilitators, the leaders who are managing the campaign, they are in real time creating a culture of your voice matters, I value and respect you. And at scale, they're learning about the most important thing to do, not one clinic at a time or one hospital at a time, but across a really broad representative group of their organization. So I think it really has a place to nurture a culture of psychological safety, of I'm valued and respected, and those are key components of joy. So I feel like those are some wins.
So that is how we are kind of elevating the voice of caregivers directly to leaders and so forth, and making them feel heard. What are your thoughts about the degree to which this is kind of facilitating relationships? Are part of these responses by team members seen by one another? Is it fostering a kind of conversation that might not otherwise happen or even be possible without a platform like this?
Yeah, so it's a really good point, Chris. I think it is fostering, who you're talking to. So you could say Amy Edmondson, who I admire a great deal, and who is an advisor to the company. One of the things she said was, wow, when you're not anonymous, you're nurturing psychological safety. When you're anonymous, you give the impression that if you share, something bad's going to happen, right? And so the responder sees who you are, the facilitator, you see who answers you back. And actually, in the doctor example I gave you, when people saw actually the chief medical officer of the organization became one of the facilitators, people were so excited to have a direct conversation with this person. So that lack of anonymity actually, again, is nurturing that connection and safety. You're having a chat, you're not having a survey. It's specific, so it's not an idea box. It's, hey, this is a problem we all acknowledge, or this is a strategic priority for the organization. We know we can't do it without you. So that targeted nature is great. And I think it doesn't replace leader rounding and being present with people. Things like focus groups, buy me breakfast, go to a staff meeting to say, what did you mean? I think can go away. And in fact, when we respect people's time and say, you want to take your kids to school, you don't want to be at a meeting with me, and we ask them kind of off cycle, that's very respectful. And then things get done that they said, that's very respectful. And it's the opportunity with AI, I think, in healthcare and the world in general, if you will, is it's making qualitative data, right? Those focus groups and things that we might have done quantitative, because you can leverage AI to, in an unbiased way, read and sort and theme things, and do the conversations in a respectful way. So we don't, with the customers that have used Joyous, even in other industries as well, people are not scared of the lack of anonymity. And in fact, it's really been a retention and, if you will, a positive culture builder in organizations.
Very interesting. So for those listening who may not have seen an approach like this before, or may not have this kind of approach to listen to frontline team members, what advice would you have about perhaps trying it for the first time? What would be your kind of, here's the things to think about, or here's the thing to watch out for?
My improvement hat says to me, at a local cultural level, we should be able to do this. At a clinic, at a unit, we should be able to sit down and say, hey, here's our problem. Falls are up, or our phone calls aren't getting answered, or our refills aren't getting done. And what are your ideas about that? So I think for an executive, the first thing is to ask yourself, are you in? Do you genuinely believe that the lived experience of the people doing the work in your organization is infinitely better than the observation of the leaders who pass through those spaces? And if the answer to that is yes, then you might say, this would be too complicated, it would take too long, right? So bust that myth. Are you willing to say, I can move at speed because healthcare is changing so rapidly. So reality is there, but I can move at speed and incorporate the voice and the knowledge of the people who do and are closest to the work every day. So if you can get yourself in that headspace, then small test of change would be, how does that look at a unit level? And I think a lot of organizations work with their leaders and sort of the management teams to facilitate sort of best learning practices that way. But as an executive, you could do that at scale, right? So you could say across many hospitals, across 200 clinics, across all of primary care, whatever your question or your need to improve is, you can focus in and not be encumbered by the fact that, wow, I might have to talk to 3,000 people. It's not have to. What a joy. And doing it at speed and at scale gives you very rich information to make things better. So I'll give you an example of an executive decision that maybe went awry, right? A health system, many health systems have put in secure messaging platforms so that they can, so that they can talk about patients among members of the team without using personal cell phones, right? Which HIPAA would not allow. So the team, the very wise said, this is a risk for our organization. Let's find a platform. They put out an RFP. They find the one with the bells and whistles that they would like. They purchase it. They install it and communicate it's here, use it, and nobody uses it.
Oh gosh.
And this happens, this happens in healthcare, and I'm sure it happens in other industries, but we're talking about us, right? And the opportunity missed in that, right, is to set up the why, right? What's getting us there, to actually ask people's ideas about what would be successful. What ideas would you have to make secure messaging work, to then impact your RFP? Then you try it, you turn it on, you use it, and you ask the people trying it, is this what we intended? How could we make it better? And then do a wide scale adoption and check in on it again. And so we don't do that in general because we feel like it takes too much time and it's too complicated and we have to go physically meet with people. And so blowing the lid off of that and saying, for very specific things, whether it's adopting a new tool or reducing falls or answering the phone quicker, right? We can now, it's possible through the advent of AI and all the technology that's at our fingertips today. We can have those conversations at scale and make our solutions better, and demonstrate to people who work in healthcare that we value their input.
Wow. And so, as much as healthcare organizations are facing tight margins and, cost increases and things of that nature, using something like this might actually help you avoid unnecessary costs by making sure that you've got the frontline team engaged and that you're going to solve the problem you're actually trying to solve.
Yeah, I'll be a little cynical. We're very good at spending millions of dollars on things that don't necessarily always work as intended. So and to be fair, right, it's never been, the advent of the explosion of great technology and great AI is newer, right? But the thought that you could, avoid not only cost, but abject failure, right? We want to fail fast and move on. And when we don't need to fail, or we could fail smaller and just make tweaks to something, why wouldn't we do that? And so I think what really spoke to me and this sort of new space for me is about that, is about what a win-win that we could solve operational issues, technology adoption, all the things we have to do at the pace of change in healthcare, and do it better than we would have done because we share the voice and leverage that voice. And guess what? No surprise, people want to work and find joy and meaning in work at places where they can make it better and make a difference. And so that's, to me, the win-win-win, right? is you can be highly successful and get the business of healthcare done, and you can engage this, just your superpower, right, is your workforce and these talented people. So win-win.
Well, certainly sounds very interesting. Do you ever seek feedback from patient family advisors when using this tool, or is it only used with employees?
So this tool has to date been used with the workforce in any given industry or organization. There's nothing that wouldn't make this tool able to talk to patients, customers in other industries, whatever, consumers, whatever term you use in your organization. So absolutely. And I think one of the things from a design perspective in healthcare we've struggled with is the fact that we've been very paternalistic, right? We say, I know what you need. I'm going to build a special clinic and this is how it's going to run. And you're going to come to me when I'm available, right? All the things we have been so good at. The fact that we can do a 360 co-design with patients is really important. And there's nothing about this tool that couldn't do that at all. And so I'm excited to think about that. Obviously, there are issues. Every organization is different in their approach and how willing they are to connect with patients in a virtual way like this. But the tool is completely capable of doing that. And in multiple languages, I might add.
Oh, good. Didn't mention
So
that.
to meet people in a way that they feel comfortable conversing.
Got it. So we've got a question from a nursing advisor, but how do you engage employees to use Joyous? Wouldn't it be the same bias as people answering surveys or attending focus groups?
That is really dependent on the organization leaning into it. So what I would say to you is we help you communicate why it's different. And it's not a survey. So there's some of that prep that happens. And then I would say it's the enthusiasm with which you ask people to engage and your facilitators take on that connection and the humanism piece of this. And what we find with many users, customers of the tool, is that the first campaign that an organization runs on a topic that matters, and they hear back that, hey, we did this, here's the problem, we asked you, here are your ideas, and we're going to go do this, and we can't go do that, but most importantly, we do this, and they see it happen, it builds curiosity and interest in participating, because then employees will say, oh, there's a campaign on whatever it is. I know that they wouldn't do a campaign if they weren't ready to act. And so that builds the enthusiasm to participate. So it is not a survey, but people are skeptical. And so you have to work that out. It probably is obvious, but no one should do a campaign in Joyous or use it if they're not going to make a change, right? So the worst thing, probably worse than not asking, is asking and not doing.
Another question, is there any measurement of increase in joy as a result of this communication being in place? What measurements or impact or results have you seen?
Yeah, so healthcare is reasonably new. I'll say in the example in nurse retention, for example, that I gave you, they did see an improvement in retention as they put into action the things that their nurses wanted. I'll tell you probably the thing that speaks most to me is we have a customer in another industry that is so big, hundreds of thousands of employees, that they were almost their own case control study. So they had a segment of their operations that used Joyous regularly to get feedback from its distributed workforce and make change, and another who hadn't rolled it out yet. And in that, the answer is yes, both engagement, a joy in work was better, and retention was better in the team that used Joyous to get the voice of their teams before they made change. And so we need more. Again, I'm at Joyous because we're young, and I think desperately that healthcare needs this kind of way to connect. And so I look forward to building a compendium of US healthcare, particularly stories about how it's made a difference.
Well, that's, I think, what the opportunity is with technology, whether it's artificial intelligence or other
Yes.
technology. If we can take the burden off of people in doing certain tasks to free up more time for them to connect with one another and to form relationships, that I think is going to pay a lot of dividends. And hopefully, this is one example of that. Now, I do have one final question for you. And my favorite is, do you have a favorite quote? And if so, why is your favorite quote?
Yeah, so I'll confess, Chris, that my favorite quotes do come and go over my life because of the circumstance I'm in and what I'm reading. One that probably sticks a little longer is Eleanor Roosevelt, who I love. You must do the thing you think you cannot do. And it speaks to my personal life, it speaks to my professional life, and I always want to challenge myself, right? It's very easy for any of us, right, to say, oh, that's complicated, or that's not my lane, or someone else will take care of that. And I believe it's my role and most of our roles to have an impact in the space we bring our talent, time, and resource to. And so even if it feels a little scary, I say go big or go home, and you fail sometimes, and that's okay. And that is an exercise to learn from as well. So Eleanor Roosevelt, one of my faves.
Well, I think it ties a nice bow around the discussion we'll be having, because a lot of what you've described in gathering feedback from team members is about change, right? And that, we've got to embrace the thing that we don't think we can do, whether it's healthcare leaders or folks on the front line. And so maybe that is a fitting quote to tie it all together for us, that we must undertake what we don't think we can do. Shannon, thank you so much for your time and insight today. We're so glad that you're a part of the humanizing healthcare community. For our listeners who want to learn more about your work and stay connected to it, where should they look? How can they keep up with what you're up to?
Yeah, so we are joyoushq.com. And if someone wants to reach out to me, it's Shannon at joyoushq.com. And I'd look forward to connecting with anybody who wants to talk more. Thanks, Chris, so much for the conversation. And thanks for pointing out in your webinar the ways people are making a difference, because it's an important time in healthcare, and I've really enjoyed listening to the conversations. So appreciate you.
Thank you as well. To our listeners today, thank you very much for joining us. We hope you found this an informative and inspiring discussion. And also be sure to join us for our next Humanizing Healthcare discussion. We'll be talking with Kevin Mahoney, Chief Executive Officer of the University of Pennsylvania Health System and the Perelman School of Medicine. It will be a great discussion. We look forward to seeing you then. Take care.